Hi everyone, I'm Anu Kathiresan, fertility physician and Dr. Mom, and here to educate on fertility. In this video, we'll be talking about weight and infertility. What is the relationship between weight and infertility? So let's talk about that today. How do you know if you're underweight or overweight? This starts with checking your BMI, which stands for body mass index. This is a calculation of body fat based on your height and weight. And there are different categories when it comes to BMI. A normal BMI is between 18.5 and 24.9. When someone is underweight, their BMI is below 18.5. Someone with a BMI between 25 and 29 is considered overweight. And then above 29 is the category of obesity. Women who are underweight often have irregular cycles, ovulation dysfunction, or amenorrhea, where they're not getting periods and not ovulating at all. It's important to work with your physician to get a workup to understand your situation better and to develop treatment strategies that will work for you if you're trying to conceive. Being overweight or obese can be associated with increased risk for ovulation dysfunction, altered egg function, altered endometrial lining function, an increased chance for miscarriage, a decreased chance for live birth. There can be sometimes an association with PCOS. If patients achieve pregnancy, there can be risks to the pregnancy for mom and baby. Some of those increased risks are preeclampsia, gestational diabetes, C-section delivery. So it's important to do what we can to achieve a healthy BMI. It is important to see a fertility specialist and a healthcare provider for a few different reasons. So the first reason is with advancing age, there's a decline in ovarian reserve. And with that decline in ovarian reserve, there's a decrease in egg number and egg quality. So your fertility specialist needs to evaluate this with you to determine maybe there is time to work on diet and exercise before trying to conceive. Maybe there may not be because we may be very concerned about the ovarian reserve. So this is an important discussion to have with your fertility specialist. It's important to also see a healthcare provider because they need to review your medical history and your BMI. Sometimes, depending on that information, first-line treatment may be diet and exercise. Sometimes they'll want to add on medication, and sometimes they'll recommend surgery. So it's important to see your physician to see what would be recommended in your particular case. That is it for this video. I hope you found it helpful. If you did, I hope you'll give the video a like. Don't forget to subscribe down below. If you have comments or questions, you can leave them for me there also. Thank you again so much for watching, and see you in the next video.